Okay, so get ready for this, everyone. We're diving into something pretty interesting today. We're going to be talking about the link between stress and knee pain.
Yeah.
We usually think, oh, my knee hurts because I pushed it too hard at the gym. But
Right. Yeah.
what if I told you that your mind could be playing a bigger role in all of this than you might realize? We're going to be looking at this connection. We've got some really cool expert tips and insights that, might just change the game for you, especially if you've tried all the usual stuff and you're still dealing with knee pain.
Absolutely.
Yeah.
It's really fascinating
Yeah.
how much our mental and emotional states can actually impact our physical well-being.
Right.
And the knees are definitely a prime example of that.
Okay, so walk us through this. I mean, it's not just about feeling tense, right? There's some like real physical stuff going on here.
Oh yeah, there's a whole cascade of events that happen in the body.
Yeah.
When we experience stress, so when we're stressed, our bodies release these hormones. Things like cortisol. And cortisol is actually a really important hormone. It helps us, wake up in the morning. It helps us deal with challenges. But the problem is when we're constantly stressed, when it's like a chronic thing,
Right.
these stress hormones are kind of pumping through our systems all the time,
Yeah.
and that can lead to increased inflammation.
Wait, so are we talking about like the same kind of inflammation that makes my knee swell up?
Exactly.
Yeah.
Yeah, inflammation is a natural process. It's part of, healing and repair.
Mm-hmm.
But when it's chronic, when it's kind of on overdrive all the time, that's when it starts to cause problems.
Gotcha.
And what's really interesting about cortisol is that it can actually interfere with collagen production,
Hmm.
which is essential for repairing our joints, our cartilage, our tendons, all that good stuff.
So it's not just causing the inflammation, it's like preventing the repair process as well.
Yeah, it's kind of a double whammy, unfortunately.
Okay.
And to make matters worse, cortisol can also ramp up those inflammatory markers that can damage the cartilage in our knees.
Okay, so this is starting to make sense to me, but how do we know this isn't just a coincidence, right? Like, how do we know it's not just, oh, well, I happen to have a stressful job and I also happen to have bad knees. Like, how?
Yeah, no, it's a great question.
Yeah.
And that's where the research comes in. So researchers have actually done studies looking at this, and what they found is that people with chronically high stress levels,
Mm-hmm.
they tend to experience more severe knee pain, even when compared to folks who have similar physical conditions. One of the sources we looked at actually highlighted this really interesting case study of a woman named Sarah,
Okay.
who was an office worker. And she had been dealing with chronic knee pain for years.
Mm-hmm.
And she had tried everything.
Yeah.
Physical therapy, medications, you name it, she'd tried it.
So all the typical things, yeah.
All the typical stuff. And nothing seemed to really, really make a lasting difference.
Okay, let me guess. Stress reduction was kind of the missing piece of the puzzle for her.
You got it, yeah. So Sarah started incorporating mindfulness meditation and cognitive behavioral therapy, CBT,
Okay.
into her routine.
Mm-hmm.
And guess what? Both her stress levels, A and D, her knee pain, started to decrease
Wow.
significantly. So it's a really powerful example of how connected these two things really are.
Okay, that's pretty amazing, actually. I'm definitely starting to buy into this. So if stress is creating this environment in the body where, there's more inflammation, there's less repair happening, does it also mess with the way we actually experience pain in our knees?
Absolutely. Yeah,
Yeah.
stress can actually change the way our brains process pain signals. So even minor twinges in your knee can feel way worse
Right.
when you're stressed out.
So it's like it's turning up the volume on the pain almost.
Exactly. It's a great analogy. Think about, like, if you turn up the volume on your stereo, suddenly those quiet sounds in the background become blaring.
Yeah.
Right? It's kind of like that with pain signals. When you're stressed, it's like your brain is turning up the volume on those signals.
So it's not just that, we're imagining it or anything. Like there's literally a different way our brain is processing the pain signals because of stress.
Yeah, yeah. And there's actually research to back this up. Studies have shown that people with high anxiety, for example, they report much more intense pain,
Mm-hmm.
even if the physical cause of the pain is the same as someone who's not anxious.
That's fascinating.
Yeah. So it's not just in their heads. It's a real physiological phenomenon.
Okay, wow. So we've got this whole thing where the stress is making the pain worse, but then the pain is probably stressing us out even more, right? So it's kind of
Hmm.
this vicious cycle.
Absolutely. Yeah,
Yeah.
it's a tricky cycle to get out of.
Yeah. But before we get to that, I'm curious about one other thing. Does stress also affect how we move? Because I could see that, if we're tense and stressed, that might actually be making things worse for our knees in terms of how we're walking, maybe even our posture.
That's a great point, and it's another key piece of this puzzle. So when we're anxious or stressed, our bodies tend to tense up,
Mm-hmm.
right? And that tension, it often concentrates around our joints,
Mm-hmm.
especially the knees.
Hmm.
And this can really restrict our movement,
Yeah.
It can affect our posture, and it can even change the way we walk, which puts more strain on the knees.
So it's almost like our bodies are trying to protect themselves, right? By tensing up and guarding the area. But in the long run, it's actually making the problem worse.
Exactly. It's kind of like a short-term solution that creates a long-term problem.
Right, right, right.
Yeah, and to make matters worse, if we're less active because of the stress or the pain, the muscles that support our knees, you
Hmm.
start to weaken,
Right.
which can lead to even more pain and instability.
Yeah. Okay, so we've got this like snowball effect happening here
Yeah.
where stress leads to tension and inflammation, which makes us want to move less, which then weakens our muscles, and then that leads to more pain. So
Right, exactly.
this is painting a pretty bleak picture. So how do we break free from this? I'm ready for some action steps here.
I hear you. Well, the good news is that the sources we've got for you today are packed with practical advice and techniques for managing stress and easing knee pain.
Okay, perfect. Let's get into that then. I want to give our listeners some real tools they can use to start feeling better.
Absolutely.
All right, sounds good.
Let's do it. One of the simplest but most powerful things we could do is something we do all the time anyway. Breathing.
Okay.
Simple breathing exercises can make a huge difference.
Really, I gotta say, breathing exercises, they always seem a little too basic. Like, how can just changing how I breathe actually help with something as complex as knee pain?
I get it. I totally get it.
Yeah.
It seems almost too simple to be true,
Yeah.
right? But think about it this way. When we're stressed, our breathing changes.
Mm-hmm.
It gets all shallow and rapid.
Right.
And that actually activates our sympathetic nervous system. That's our fight or flight response,
Okay, you're
the one that
right.
gets us all amped up. But when we do these deep, slow breaths, it's like hitting the brakes on that stress response.
Okay.
We can actually shift our nervous system into a more relaxed state,
Hmm.
calming down those stress hormones and easing tension all over.
Okay. All right, I'm willing to give it a shot. So what kind of breathing exercises are we talking about here?
Well, there are a bunch, but one that's really effective is called diaphragmatic breathing. Sometimes people call if belly breathing.
Okay.
And it's pretty simple. So you put one hand on your chest and the other on your belly, just below your rib cage,
Mm.
and then you breathe in slowly through your nose.
Yeah.
And as you breathe in, feel your belly expand like a balloon.
Okay.
And then as you breathe out through your mouth, you gently draw that belly button back towards your spine.
I'm actually trying it right now, and I do feel like I'm letting go of some tension actually, just in my shoulders and my neck.
Right. See?
Yeah.
It's pretty amazing.
Yeah.
And the best part is you can do this anywhere, anytime.
Mm-hmm.
Stuck in traffic. Take a few deep breaths.
Yeah.
Sitting at your desk. Deep breaths. Lying in bed. Deep breaths.
Okay, I'm sold. Breathing exercises are officially in my stress-busting toolkit now.
Awesome.
All right, so what else? We talked about mindfulness and meditation earlier. Is that stuff really as helpful as everyone says it is?
Oh, absolutely. Mindfulness practices, things like meditation, they help us to just be present in the moment,
Okay.
noticing our thoughts and feelings without judging them.
Yeah.
And that can be super helpful for managing both stress and pain.
I've tried a meditation before, but I always get distracted. Like thoughts just pop into my head, and it's like, forget it, I can't do this.
It's so normal.
Yeah.
Everyone experiences that.
Yep.
Yeah. It's not about emptying your mind completely. It's more about learning to observe those thoughts without getting carried away by them.
All right.
So when thoughts come up, you just notice them.
Mm-hmm.
And then you gently redirect your attention back to your breath
Okay.
or whatever your focus is.
So it's more like we're training our attention, kind of like training a puppy, maybe.
Exactly. It takes practice and patience.
Yeah.
But over time, you get better at it.
Okay.
And you start to cultivate this sense of calm and clarity that goes beyond your meditation sessions.
So it's like building a mental muscle that can help us deal with stress and pain better.
That's a great way to put it. You're building that mental resilience.
Okay, I like it. So it's not just about trying to like ignore the pain or anything. It's about changing how we relate to it, like from the inside out.
You got it. And speaking of changing how we relate to pain, we should talk about something called central sensitization.
Central sensitization. Okay, that sounds a little intense. What is that exactly?
It's basically when your nervous system gets overly sensitive to pain signals.
Okay.
So it's amplifying even those minor sensations into something that feels like a lot of discomfort.
So it's kind of like our nerves are on high alert even when there's no real danger.
Right. And that heightened sensitivity, it can be triggered by chronic stress, inflammation, even past injuries.
Wow. So it's like our bodies are holding on to those past experiences even when we think we're over them.
Yeah, in a way.
So is there anything we can do about that? Can we like rewire those pain signals?
There are actually some really promising therapies that specifically target central sensitization.
Okay, that's good to hear. What kind of therapies?
Well, one approach is called nerve flossing.
Nerve flossing.
Yeah, I know, it sounds a little strange, but it involves specific exercises that are designed to kind of mobilize and desensitize those irritated nerves.
So how does that work? What do you actually do?
So imagine a nerve like a thread that runs through your body. When that thread gets tangled or compressed, it can send out pain signals. Nerve flossing uses these gentle movements that help to glide the nerve through its surrounding tissues,
Oh, okay.
easing tension and reducing that irritation.
So it's kind of like an untangling those knots in our nervous system.
Exactly. And then another promising approach is biofeedback.
Okay. We talked about that a little earlier.
Yeah, and this can really help us gain more conscious control over things in our body that usually happen automatically.
Like what kind of things?
Well, like muscle tension, heart rate,
Mm-hmm.
even brainwave activity.
Wait, are you saying we can actually learn to control things like our heart rate and our brain waves?
To a certain extent, yeah.
Wow.
Biofeedback uses these sensors to monitor your body's responses in real time,
Okay.
and it gives you feedback,
Mm-hmm.
visual or auditory feedback. So you can actually see or hear what's happening in your body as it's happening.
Mm.
And with practice, you can learn to influence those responses.
Wow, that sounds pretty futuristic. But I love the idea of like taking control of our own healing.
Right. It's empowering.
Yeah.
And it shows us that our nervous systems are incredibly adaptable.
So even if we've been dealing with knee pain for a long time, it's not necessarily a life sentence.
Nope, not at all.
Yeah.
We can retrain our brains and bodies to respond differently.
That's a really powerful message. And it seems like it really reinforces this idea of taking a holistic approach, right? Like
Yeah.
looking at the physical, the mental, and the emotional aspects of the pain.
Exactly. It's all connected.
This is all really eye-opening. I feel like I'm seeing knee pain in a whole new light now. It's not just about fixing the joint itself. It's about understanding this whole web of connections between our minds, bodies, and experiences.
You've got it. And the more we understand those connections, the more we can do to manage our pain and create a life that we love.
Okay, so this deep dive has definitely shifted my perspective, but I'm curious, are there any like lifestyle changes that can help us break free from this cycle?
There are actually a ton of things we can do in our daily lives to support our knee health and manage stress.
Okay, great. Let's hear them.
Well, let's start with one of the most basic but essential things.
Sleep.
Sleep.
Huh.
Okay, I'm always down for a good nap, but how does sleep relate to knee pain?
Well, when we don't get enough sleep, our bodies produce more cortisol, that stress hormone we talked about,
Right.
and that ramps up inflammation and slows down tissue repair,
So lack of sleep is like throwing gasoline on that fire of inflammation.
pretty much. Plus, good sleep is crucial for muscle recovery and growth. So if we're not getting those zizzies, our muscles aren't getting a chance to repair themselves properly, which means our knees are more vulnerable.
Gotcha. Okay, I'm seeing the connection now.
Hmm?
But I have to admit, I'm not always the best sleeper.
It happens. A lot of people struggle with sleep,
Yeah.
but there are things you can do. Consistency is key. Try to go to bed and wake up around the same time each day,
Okay.
even on weekends.
Even on weekends. All right. That's tough.
I know, but it really helps.
And create a relaxing bedtime routine.
Like what?
A warm bath, reading a book, listening to calming music.
Ooh, a lavender-scented bath with a good book. Sounds pretty good right now.
Right. And make sure your bedroom is cool, dark, and quiet.
Okay.
No screens before bed.
No screens before bed. Got it.
It makes a big difference.
Okay, cool. Dark room, relaxing, bedtime ritual. Anything else?
Yes. Physical activity is huge.
Okay, wait. Don't tell me I have to start running marathons with my bad knees.
No, no marathons necessary.
Yeah.
We're talking about gentle, low-impact exercise.
Okay.
Things like swimming, yoga, or even just walking.
I do love a good walk, especially out in nature. So calming.
And it's fantastic for strengthening those muscles that support your knees.
Mm-hmm.
Even a short walk every day can make a big difference.
So we're talking about building up those supporting muscles to take some of the pressure off the joint.
Exactly. Take some of the burden off those knees.
Okay, that makes sense. And while we're talking about movement, what about stretching?
Stretching is essential. Regular stretching helps increase your flexibility, reduce tension, and improve circulation to those muscles around your knees.
Yeah, I definitely notice that when I'm stretching regularly, my knees just feel less stiff and achy.
Right. There's a simple hamstring stretch that's really helpful for knee pain.
Okay, how do you do it?
Sit on the floor with your legs extended in front of you.
Yep.
Reach towards your toes, keep your back straight, and you'll feel that gentle stretch in the back of your thighs.
Oh, yeah, I do that one all the time. Feels so good to stretch those hamstrings.
Right. Hold it for about 30 seconds, breathe deeply, and then switch legs.
Perfect, yeah.
Incorporating that into your daily routine can really help.
Okay, so we've got breathing techniques, mindfulness, sleep, exercise, stretching. What about food? Does what we eat affect our knees and our stress levels?
Absolutely. Food can be a powerful tool for managing both.
Okay, so what should we be eating? What are some of those, like, superfoods we should be stocking up on?
Well, a diet rich in anti-inflammatory foods can help calm down that inflammatory response we've been talking about.
Okay, so what are we talking about?
Think colorful fruits and vegetables.
Okay.
Blueberries, strawberries, leafy greens.
Mm-hmm.
They're packed with antioxidants that fight inflammation.
I do love my blueberries.
And then fatty fish like salmon and tuna.
Ooh, I love salmon. I try to eat that at least once a week.
Excellent. Those are loaded with omega-3 fatty acids, which are super anti-inflammatory.
Okay, omega-3s. What else?
Nuts and seeds are great too,
Okay.
like walnuts and flax seeds. And don't forget about turmeric.
Turmeric, that's a spice, right?
Yeah, it's a spice that's been used for centuries for its anti-inflammatory properties.
Okay.
You can add it to curries, smoothies, or even just sprinkle it on roasted vegetables.
Okay, I'm feeling healthier just thinking about all this delicious food.
Right. And what about supplements?
Oh, yeah, supplements. Are there any that can help with knee pain and stress?
There are a few that have shown promise.
Mm.
Glucosamine and chondroitin. Those are naturally found in cartilage and might help support joint health.
So they're kind of like building blocks for our joints.
Exactly. But it's always a good idea to talk to your doctor before starting any new supplement.
Right, right.
Just to make sure they're safe for you and that they won't interact with any medications you might be taking.
Yeah, always good to get that professional advice.
And keep in mind, supplements aren't magic bullets.
Right.
They work best when combined with those lifestyle changes we've been talking about.
Okay. So it's about that holistic approach. Again,
Always.
right. This is all really valuable information, and it's clear that managing knee pain isn't just about, like, popping a pill or something. But I'm wondering, beyond the physical stuff and the lifestyle changes, what about the mental and emotional side of things? How can we address those aspects of dealing with chronic pain? It's so easy to get caught up in the physical part of it, right? But we can't forget about the mental and emotional side of dealing with knee pain. That's got to be a huge part of it.
Yeah, absolutely. I mean, we actually see this in the research. There's a strong connection between chronic pain and things like anxiety and depression.
Oh, wow.
It's kind of a two-way street, Having chronic pain can increase your risk for mental health issues. But then those mental health issues can actually make the pain feel even worse.
Yeah, that makes sense. It's like they feed into each other. So how do we break free from that? Like, how do we start to shift our mindset and our emotions when we're dealing with knee pain?
Well, one of the most helpful things is something we talked about already, mindfulness.
Okay.
When we practice mindfulness,
Yeah.
we can learn to just observe our thoughts and feelings about the pain without judging them.
Mm.
And that can create a little bit of space, a little bit of separation between us and the pain.
Right. So instead of, like, getting totally swept up in the, oh no, my knee hurts again kind of spiral, we can acknowledge it without letting it take over.
Exactly. And from that place of mindful awareness, we can start to use some other strategies too. One technique that's really effective is called cognitive reframing.
Cognitive reframing. Okay, I've never heard of that. What is that?
So basically, it's about challenging those negative thoughts that can contribute to our pain.
Right.
Like, for example, if you keep telling yourself, my knee will never get better,
Yeah.
or I'm just going to end up in a wheelchair, those thoughts are actually going to amplify your pain and make you feel more hopeless.
Yeah, I can see that. Like if you're constantly feeding yourself those negative messages, it's not going to help.
Right. So with cognitive reframing, we can learn to spot those unhelpful thoughts and swap them out for more balanced, more realistic ones.
Okay. Give me an example.
Sure. So instead of saying, I'm never going to be able to hike again,
Mhm.
you might say, I'm working on strengthening my knee, and maybe one day I'll be able to hike again.
Okay, yeah. So it's about shifting our focus from what we can't do to what we might be able to do in the future.
Exactly. And even those little shifts in perspective can make a big difference in how we feel, in our motivation, and even in our physical experience of the pain.
It's amazing how much our thoughts can really affect us. But but how do we actually reframe those negative thoughts? I mean, it sounds great, but it also sounds kind of hard.
Oh, it definitely takes practice.
Yeah.
But a good place to start is just by becoming aware of your thoughts.
Mm.
Pay attention to the stories you're telling yourself about your knee pain.
Mhm.
Are those stories helpful or unhelpful? Are they based in reality or are they based in fear?
So it's almost like we have to become like detectives for our own thoughts.
Right. Exactly.
Mm.
And once you start to notice those unhelpful thought patterns,
Mhm.
then you can start to challenge them.
Okay.
Ask yourself, is there another way to look at this? What evidence do I have to support this thought?
Okay. Yeah.
And then from there, you can start to try out some new, more empowering, more realistic thoughts.
Right.
It's a process, though. It takes time and effort.
Yeah.
And sometimes it can be helpful to work with a therapist who specializes in chronic pain management. They
Right.
can really guide you and support you as you're working through all of this.
Yeah, sometimes we need a little extra help to see things differently and learn those new coping skills.
Absolutely. And, we've talked a lot about the mental and emotional piece of knee pain,
Hmm.
but what about our social connections? Those relationships in our lives, those can actually play a big role in how we heal too, you know?
Yeah, I mean, it makes sense. When we feel supported and loved, we tend to be more resilient no matter what we're going through.
Right. Studies have actually shown that people with strong social support networks, they tend to have less pain, they cope better with stress, and they even recover faster from illness and injury.
Hmm, that's really interesting. But I imagine it can be tough to stay connected, especially when you're dealing with chronic pain.
Yeah, it definitely can be. I mean, things that used to be easy, maybe going out with friends, doing activities, those things might become difficult or even impossible.
Right.
And that can lead to isolation, which just makes everything worse.
Yeah, it's tough. So what can people do if they're struggling with this? Like how can they maintain those connections?
Well, first of all, communication is key. Talk to your loved ones about what you're going through. Let them know how they can support you.
Yeah.
Maybe it's finding new activities you can enjoy together.
Hmm.
Or maybe it's just asking for help with everyday tasks.
Right. And it's okay to ask for help too. It's sometimes we feel like we have to be strong and push through it on our own,
Yeah,
but letting people in can make a huge difference.
absolutely. And don't forget about support groups.
Right.
Connecting with other people who are going through the same thing can be so powerful. It can give you a sense of community, it can validate your experience,
Yeah.
and it can give you hope.
Yeah.
Yeah.
There's nothing quite like sharing experiences and learning from others who really get it.
Totally. And remember, even small acts of connection can make a difference.
Mm-hmm.
A phone call with a friend, a video chat with family, or even just sending a text message to someone you care about.
Right.
Those little moments can really help
Yeah.
to boost your mood and make you feel less alone.
This has been such an amazing conversation. We've covered so much. The
Sure.
connection between stress and knee pain, the role of inflammation and movement, the importance of sleep and nutrition, and then, of course, this whole piece about the mind-body connection, how our thoughts and emotions play such a big role.
Yeah, it's really all connected.
It really is. I feel like I have a completely different understanding of knee pain now, and I feel so much more empowered to take care of myself, to take a more holistic approach.
That's fantastic to hear. And that's really what we hope you'll take away from this.
Yeah.
It's not about finding a quick fix. It's about really understanding this complex issue and then finding what works for you.
Right. It's about becoming an active participant in our own healing journey.
Exactly.
All right, so as we wrap up, we just want to encourage you to think about what resonated with you most today. What one small change can you make this week to support your knee health?
Maybe it's committing to that daily stretching routine we talked about.
Mm-hmm.
Maybe it's trying out a new anti-inflammatory recipe. Or maybe it's just reaching out to a friend or a loved one for support.
Yeah, whatever it is, remember, even those small, consistent actions can add up to big changes over time.
Absolutely. You got this.
We're cheering you on every step of the way. Until next time, keep those minds curious, those bodies moving, and those hearts compassionate.
And never underestimate the power of your own healing potential.
That's a wrap on our deep dive into knee pain and stress. We'll catch you next time for another fascinating exploration into the world of health and well-being.